Now, another thing that we are going to talk about is the blood vessels. Now, this is another important component of the circulatory system. If you remember, we were talking about how the blood was flowing from one organ to the other. We were saying that suppose the oxygen was flowing from, or the blood was taking the oxygen from the lungs and it was going to all the parts of the body and providing optimum oxygen to those parts, right? Then we also said that the carbon dioxide was transported back to the lungs, right? We said that the waste products were also removed, which also contains carbon dioxide. So how do this blood flow, or where exactly do these blood flow? So the blood that is carrying all this material, that is your oxygen or the nutrients or the waste products, flows in the blood vessels. There are mainly two types of blood vessels. One is the arteries, right? Other is the veins, right? Both of these are your blood vessels. These are pipe-like structure which allows the flow of blood within them, and it allows the movement of blood from one organ to the other organ, and these are well connected. It's the whole circulatory system is a well connected network of these blood vessels. There is another kind of blood vessel that is present, and we are going to discuss that type of blood vessel a little later, and that is capillary, right? We are going to understand what exactly is a capillary and how it is related to arteries and veins, right? Now, when we are talking about the blood vessels, if we talk about the movement of blood from one part to the other, so we see that the movement of oxygen takes place from lungs to rest of the body, right? And the carbon dioxide from the body to the lungs, right? And within these arteries and veins, right? So oxygen is taken from the lungs and it goes to the rest of the body through heart, obviously, right? Through heart, and then CO2 is collected from the body, and again through heart it goes to the lungs for disposal. Apart from that, waste material is also collected and it is transported through these veins and arteries, right? Why we are discussing this? Why we are discussing the movement of oxygen and carbon dioxide? Because this will help us in understanding or it will give us a little more or better understanding of the function of arteries and veins. First of all, let's talk about the artery. Now, artery is a vessel which transports oxygen. That means artery will take up the oxygen from the lungs and it will transport, or rather I should say, the transport of oxygen takes place from the lungs to the heart, and then it will happen from heart to other parts of the body, right? Of the body. Correct? So, the artery will help in the transportation of oxygen. First thing which you need to remember is artery always takes the blood that is oxygen rich. Apart from that, the artery is moving from heart to the rest of the body, right? So, the movement is away from the heart, rest of the body. Now, the speciality of the structure of the artery is that it is a thick walled vessel, right? It is a thick walled vessel. The reason for this thick wall is that, as you saw, that the direction of the movement of blood was from her heart to rest of the body. So what happens is, as we know, that heart is pumping, right? It is pumping the blood into the vessels, and that vessel particularly is the artery. So the so the blood that is being pumped into the artery might, break the artery or might break up the vessel if it is thin walled. That is the reason why, to endure this jerk which is happening because of the pumping of the heart, the artery is thick walled, right? So again, to understand this a little better, that if suppose the artery was very thin and the blood was pumped with force into the artery might burst, right? Because the artery has a thick wall, it is able to endure the jerk that is happening because of the pumping of the heart, right? This also helps in the forward movement of the blood, right? Because of this pumping movement, because of the jerk that is happening in the artery, the blood is moving forward towards the rest of the body, and there is no, you can say, danger of the blood returning back. So suppose if we talk about, say, this is a vessel, so the blood moves in this direction. If there was no jerk, that is, if there was no jerk that is happening in the artery, what would happen? The blood might flow back, because obviously it's a liquid. It can actually flow back towards the heart, but this doesn't happen in the artery because of the jerk of the heart, right? Because of the pumping of the heart which is happening, right? So in this way we see that first of all, artery has the function of transportation of oxygen. It is a thick walled vessel. The direction of the blood is from the heart to the rest of the body, and also it is able to endure the rapid flow of the heart, right? Now, to understand it a little better and to understand the importance of arteries, what we are going to do is we are going to perform an activity. Now, what you are going to do, that you take your hand and put these two fingers on your wrist area. Now, when you are putting this like this, when you are putting it, you do not apply a lot of pressure, just feel the throbbing that is happening, right? So throbbing means like jerky movement you will be able to feel over here. Keep it for a little while and feel the movement that is happening underneath the skin. What you will be able to feel is some throbbing movements, right? And the question that arises from this activity is that why do you think that there is throbbing, right? So this throbbing is known as the pulse, right? So this throbbing which you are able to hear or which you are able to feel is called as the pulse. You must have seen doctors checking your pulse, right? If when you go to a doctor, you say that you're not feeling well, the one thing which the doctor does is he or she holds your hands and feels for the pulse to understand that at what rate the heart is beating. So how do you think the pulse is being created? We've already talked about how the heart is pumping, and because of that pumping, there is a rapid and jerky flow of the blood in the arteries, right? And this is what the pulse is, right? Because of this jerk which is happening when the heart is pumping, the pulse is created, right? So, when you are able to feel this pulse, that means that the heart is pumping blood into the arteries. Now, another thing which you can do is look at a watch and count for 1 minute. How many pulses can you count in a minute, right? That is called as your pulse rate, right? So, the number of pulses in a minute is known as the pulse rate. So, what is a pulse rate? Number of pulses in a minute is known as pulse rate, right? So at the resting phase, that is when I am sitting over here like this, or when you are sitting and checking your pulse, it is 72 to 80 per minute for a healthy human being, right? So again, what is a pulse? Pulse is created when the blood is flowing in jerks into the artery, and the number of pulses in a minute is called as the pulse rate, right? And it is 72 to 80 pulses per minute for a healthy person. Now, when you have done this activity, when you are able to count the pulses, you can go one step further, and what you can do is that you can do this activity with your friends, right? Put down their names with your friends and families, and then you can check their pulse per minute, right? How many pulse are you able to count, right? So, and you can compare the pulse rates of you and your friends and your family. And that's why, and that's how you will be able to compare that, yes, when we say that a healthy human being has the pulse rate as 72 to 80, it's a correct data, right? Now, moving on, the next vessel that we are going to talk about is the vein. So, vein is the blood vessel that carries or it transports carbon dioxide rich blood. Now, when it is transporting carbon dioxide rich blood, you can also assume that the transportation will be, you can also understand that the transportation will be from rest of the body to the heart. So, you can see that the movement or in which the blood is, or the direction which the blood is going is towards the heart. In the arteries, we saw that the direction was away from the heart, whereas in veins, the blood is moving towards the heart, right? Because it is carrying carbon dioxide rich blood. What happens is that this carbon dioxide rich blood reaches the heart, and from there it goes to the lungs, and the lungs are able to exhale the carbon dioxide, right? Now, apart from that, veins are thin-walled, comparatively thin-walled. When you compare the veins and arteries, you will find that veins are comparatively thin. Arteries, on the other hand, have a thick wall. Apart from that, veins have valve. Now, these valves are the ones which prevent the backflow of blood, right? So, what is happening is that in the vein, the blood is not flowing with speed. When we were talking about arteries, the blood was flowing in a jerky manner and it was rushing in with speed. When we are talking about veins, because it is going towards the heart, the blood is not flowing in speed, and that is why it has valves in it, so that it can, it can protect the blood, or it can avoid the blood from moving back. So when suppose it is going, assuming it is going from brain towards the heart, right? So what will happen, that over here you have the valve, so that the direction remains this way and it doesn't go back to the brain, right? So to avoid this kind of backflow, the veins have valve, because blood is flowing slowly, right? So the speed is not like we saw in the case of arteries, right? So this is the function of veins. Now, moving on, let's talk about a confusion that Bujo has. Now he is confused. He has learned that artery always carries oxygen-rich blood. Pahili explained that pulmonary artery carries blood from the heart, so it is called an artery and not a vein. It carries carbon dioxide rich blood to the lungs. Pulmonary vein carries oxygen rich blood from the lung to the heart. Now please understand, this confusion is very valid and many students actually have this kind of confusion. So, what is happening over here is, we have seen when we are talking about arteries, there were 2 points that we had specified. First was that it transports oxygen rich blood, and other was that it takes the blood away from the heart. Right? These were the 2 points that we have, we have enumerated when we were talking about artery. When we were talking about veins, there were again 2 points, that veins carry carbon dioxide rich blood and they take the blood towards the heart. But there is an exception to this rule, right? Particularly for this rule. right? What is the exception? The exception is pulmonary artery and pulmonary vein. What is the difference between the two? Always remember, one rule remains constant, that is, the blood will always flow away from the heart. And when we are talking about artery, when we are talking about vein, the blood will always flow towards the heart. So when we are talking about pulmonary artery and pulmonary vein, this rule, right, this rule remains constant. Let me explain you with the help of this diagram. But before I do so, always remember this rule remains the constant, that in artery the blood will flow away from the heart, and in the vein the blood will flow towards the heart. Now, what is happening over here is that artery, that is the normal artery, is taking the oxygen to the different parts of the body, and the vein is taking carbon dioxide from the different parts of the body to the heart. Now remember students, heart does not causes the exchange of gases, because this is not the organ which is having a lot of air in it, right? The organ which causes the exchange of gases from the atmosphere is the lung. So for removing the carbon dioxide, the blood has to go to lung, and for obtaining oxygen also the blood needs to come from the lung, right? So till heart, what is happening, that the blood is, when we talk about vein, the blood is coming from the rest of the body and it is coming up to the heart. Now this blood, which is rich in carbon dioxide, has to go to lungs so that the carbon dioxide can be removed and the blood can become rich in your oxygen. Now what is the direction of the blood? That is away from the heart. So what vessel will be used? It will be the artery. That is why we say pulmonary artery is the one which carries carbon dioxide rich blood to the lungs, right? So we say pulmonary artery carries carbon dioxide rich blood to the lungs, that is away from the heart. Once the blood has reached the lung, the exchange of gases takes place, and now the blood is rich in oxygen. Now it has to go back to the heart so that the heart can pump this oxygen rich blood to all the parts of the body. That means the movement of blood is towards the heart. That is why the vessel which is carrying this movement is called as the pulmonary vein, which is rich in oxygen, and it is taking the blood to heart, right? So over here you can see that this is the only exception, that is pulmonary artery carries carbon dioxide rich blood, whereas pulmonary vein carries oxygen rich blood. Always remember this exception whenever we are talking about the arteries and veins, right? I hope you were able to understand this concept clearly. It's a very, very important concept. When we will talk about the pumping of the heart and the structure of the heart, you will be able to understand it a little better. Now, the other vessel that we were talking about, which is again a very important vessel, that is called as the capillary. Now, if you look at the capillary, they are the smaller vessels that are divided, right? That are formed after the division of artery. So, suppose as you can see that there is this artery which is divided into further smaller, the vessels called as the capillary. These are very thin walled. It's not just thin, they are very thin walled vessels. These are formed by the division of the artery. These capillaries help in transport of blood to the smallest part, to all the parts of the body, that is, even the smallest part of the body receives your blood from the capillary. These are so thin that if you must have seen that when you have a little paper cut also, you see that there would be a little blood. What exactly is being cut over there? It is not artery, it is not vein, it is the capillaries which are being cut. Whenever there is even a superficial blood, whenever there is even a superficial cut on your hand or on your leg, you will see few drops of blood are released at that point of time from your body, from the wound, and that is because the capillary are burst open, right? Now, when the oxygen is transported to all the parts of the body, the capillaries combine to form the vein, because then they are carrying carbon dioxide, and this vein then further goes into the heart. So, understand that capillaries have a very important role in the transportation of carbon dioxide and oxygen to all the parts of the body, that is the collection of carbon dioxide from all the parts and giving oxygen to all the parts, right? Now let's talk about another important aspect, that is blood donation. Why we are talking about it? Because it's a very, very important, you can say a social, a social service that a person should do. Any healthy person, there are a lot of people are dying because of the lack of blood availability. Any healthy person is able to donate blood without causing any harm to their own body, right? So everybody should donate blood so that any patient which is in the need of blood can easily receive the blood on time, right? This donation of blood does not cause any harm to your body, right? Whenever you reach a proper age, then you can go to the blood banks, you can go to the hospitals and donate blood,